18%. If you play soccer and you suffer a hamstring tear, there is this staggering 18% chance you are going to tear it again.
Yeah, which is just incredibly frustrating for anyone who's been through it.
Right. I mean, you do the physical therapy, you ice it, you rest until everything feels, absolutely perfect. And then the second you hit top speed on the pitch, bam, it pops all over again. Like, why?
Well, because for decades, we have been treating the victim, not the actual culprit.
Wow. Yeah, that's exactly it.
It really forces a profound shift in how we view the human body.
Yeah.
We are entirely conditioned to, look at the specific site of our pain and just assume that is the origin point of the pathology.
Of course we do. It hurts there, so the problem must be there.
Exactly.
Right.
But in a complex kinetic system like a sprinting human, the site of the pain is often just the weakest link. It's snapping under pressure that's generated somewhere else entirely.
So today's deep dive is going to completely change how you think about sports injuries, rehabilitation, and honestly, your own body's mechanics.
It really will.
We are pulling our insights today from a brilliant 2024 peer-reviewed article. It's titled, Characterizing Muscle Activity in Soccer Players with a History of Hamstring Strain Injuries During Accelerated Sprinting.
Quite a mouthful, but incredibly important research.
Yeah, definitely. This was authored by Ohtsubo, Hiromi Saito, and Norikazu Hirose from Waseda University, and it was published in the Journal of Sports Science and Medicine.
A very solid publication.
For sure. So our mission today is to bring some accessible scientific clarity to that massive 18% recurrence rate. We are going to look at the absolute micromechanics of a sprint to really understand why that muscle keeps failing.
And to truly appreciate the weight of their findings, we really have to look at the methodology.
Right.
Because the researchers didn't just evaluate athletes doing static stretches on a padded clinical table. They analyzed the dynamic, violently fast reality of the sport itself.
Okay, let's unpack this. Let's set the stage for how they actually captured this data because it is incredibly rigorous.
It is.
So they brought in 26 male soccer players. 13 of them were totally healthy with a zero history of hamstring issues. The other 13 had a documented history of non-contact hamstring strain injuries, or HSI.
Right, non-contact being the key word there. It just happens while running.
Exactly. And to see what was happening beneath the skin, they attached high-frequency surface electromyography, or EMG, electrodes to 10 different muscles on these players.
10 different muscles all at once.
Yeah, all at once. Then they set up high-speed cameras shooting at 240 frames per second and had everyone run a 30-meter maximal sprint over artificial turf.
And that 30-meter distance is a really critical parameter here.
Yeah.
Statistical models show that 96% of sprints in a soccer match are actually shorter than 30 meters.
Wow, really? Almost all of them?
Almost all of them. So the researchers are specifically testing these athletes in the exact acceleration window where over 56% of all sprint-type hamstring injuries occur.
Ah, so they are hunting for the breakdown in the exact environment where the breakdown usually happens.
Exactly. They wanted to capture the real-world conditions.
Let's pause and talk about the surface EMG for a second, because I think we need to understand what those electrodes are actually measuring.
Sure.
Because we usually think of muscle activity as just the physical flexing or, bulging of the tissue. But an EMG is measuring something much deeper, isn't it?
It is, yeah. Surface electromyography measures the electrical command coming directly from your central nervous system.
Okay.
Before a muscle can physically contract, your brain has to send an electrical action potential down the motor neuron, basically to tell that specific muscle fiber to fire.
Like a literal electrical signal.
Precisely. The EMG is picking up that electrical chatter.
Mm.
So it tells us not just how hard a muscle is working, but the exact millisecond the brain attempts to activate it.
So we are looking at the software commands, not just the hardware.
That's a great way to put it. We're looking at the software.
Which is vital, because to map those software commands, the researchers sliced a single, blindingly fast-running stride into 5 distinct scientific phases.
Which is necessary when you're looking at something this fast.
Right. So you have the early stance phase, which is the exact millisecond your foot strikes the turf. Then the late stance phase, as your body moves over the foot and pushes off.
Then the foot leaves the ground.
Yeah. The early swing phase, as the leg comes up off the ground. The mid-swing phase, as the knee drives forward through the air. And finally, the late swing phase, right before the foot comes back down to strike the earth again.
And breaking a continuous explosive movement into those specific chronological phases is really the only way to isolate the immense biomechanical demands placed on the body.
Because it's happening in the blink of an eye.
Literally. I mean,
Yeah.
a sprint is a cycle of absorbing force and producing force over and over again.
So the researchers have the cameras rolling at 240 frames per second. They have the electrical data mapping the brain's commands to the muscles. What did they find when they looked at the biceps femoris? Like, that is the primary hamstring muscle that we are talking about tearing here.
This is the crazy part. The data showed absolutely no significant difference.
Wait, none?
None. Throughout all 5 phases of that violent sprint cycle, the electrical activation of the hamstring in the healthy players and the previously injured players was virtually identical.
See, that is the part of this study that completely blew my mind.
Right.
The muscle that routinely tears, the muscle that literally everyone assumes is fundamentally weak or compromised, is receiving the exact same signals and firing the exact same way in both groups.
It's doing exactly what it's supposed to do.
It's like repeatedly replacing a blown tire on your car, only to realize the tire isn't the problem at all. Your suspension is misaligned, and the tire is just the thing that takes the damage when you hit a pothole.
That's a perfect analogy. What's fascinating here is how we classify the hamstrings anatomically. They are what we call articular muscles.
Articular muscles, okay.
Yeah, they are unique because they cross 2 separate joints, the hip and the knee.
Ah, I didn't realize that.
Yeah, most muscles just cross one joint. Because they span across both of those hinges, the hamstring's resting length, its tension, and the total physical load it has to bear are entirely dictated by the positioning of the hip, the knee, and the pelvis.
So the hamstring is just a passenger in this system, not the driver.
Exactly. And because it is a passenger, it is completely at the mercy of the surrounding structures.
Right.
If the pelvis tilts anteriorly, meaning it dumps forward, or if the trunk leans too far forward, it physically pulls that hamstring taut from the top down.
Oh, wow.
So if the electrical activity of the hamstring itself is normal, like we saw in the EMG data, the injury is merely a symptom.
The root cause, that misaligned suspension in the analogy.
Exactly. It has to be coming from the muscles responsible for controlling the pelvis and the trunk.
Which is such a massive takeaway for you listening right now. Just think about how much time we spend hyper-focusing on the exact spot that hurts.
Too much time.
We use massage guns, foam rollers. We do all these targeted stretches right on the side of the pain, completely blind to the surrounding mechanics that are actually generating the stress.
Yeah. If the hamstring is doing its job normally, we have to follow the kinetic chain to find out where the structural integrity is actually failing before the tear happens.
Okay, let's follow that chain chronologically. If the breakdown isn't happening in the hamstring itself, what is happening in the body right before the foot hits the ground?
That brings us to the late swing phase.
Right, where the leg is whipping forward through the air, about to strike the turf. This is where the researchers uncovered the first massive discrepancy in the data.
Yes. The EMG readings showed a severe drop-off in the gluteus maximus.
The primary glute muscle.
Exactly. During that critical late swing phase, the electrical activity in the Gmax of the previously injured leg was 30% lower compared to the healthy players.
30% is a huge deficit.
Math.
But I have to admit, I'm a little confused by the mechanics here. We usually think of the glutes as the engine that pushes us forward, right?
Sure, that's the common perception.
Like you squeeze your glutes to jump or to push off the ground out of the starting blocks. Why does a drop in glute power matter right before the foot even touches the ground?
Well, it requires adjusting how we view the functional role of a muscle depending on the phase of movement. You are correct that the glute is a massive extensor used for pushing.
Okay, good. I'm not totally crazy.
Not at all. But during the late swing phase, your leg is moving forward through the air at its maximum angular velocity.
Right.
You have an incredibly heavy pendulum swinging forward at absolute top speed. Before that foot can safely strike the ground and bear your body weight, that massive forward momentum has to be controlled and slowed down.
Oh, I see. It has to put on the brakes before impact.
Exactly. That braking mechanism is called centrifugal loading. The gluteus maximus and the hamstring are designed to work together as a synchronized dual braking system.
A dual system.
Yes. They fire eccentrically, meaning they contract while lengthening, to violently decelerate the swinging leg so it doesn't just crash uncontrollably into the turf.
Okay, that makes perfect sense. It's like a tandem bicycle where the front rider suddenly stops pedaling right as you go downhill, or, to stick with the car thing, slamming on the brakes of a speeding car.
Right.
The glute is your really powerful front brake, and the hamstring is the smaller rear brake. If that front brake suddenly fails, like if the Gmax is underactivating by 30%, all that massive forward momentum doesn't just vanish.
Nope, physics doesn't allow that.
It gets transferred entirely to the rear brake.
And so the hamstring is suddenly forced to absorb almost the entire deceleration force all by itself.
Oh, wow.
And is being forced to do this precisely at the moment when the leg is reaching forward, meaning the hamstring is in its most stretched, vulnerable anatomical position.
It is doing a two-person job all by itself while stretched to the absolute limit. It's a miracle it doesn't snap right then and there.
Sure.
But as the data shows, failing to brake is only the first domino to fall. What happens to the rest of the body when that under-decelerated 180-pound pendulum finally slams into the earth?
And that moves us from the late swing phase directly into the early stance phase.
Right, the exact millisecond of impact.
Yes. The early stance phase is where the sheer violence of a sprint truly manifests. In the millisecond the cleats bite into the turf, the body has to absorb massive ground reaction forces, often several times the athlete's body weight.
Just a huge shock wave.
Huge. And it has to absorb it while maintaining absolute structural rigidity. The trunk and the pelvis have to be a rock-solid platform.
And the EMG data from the study proves that the previously injured players have a complete breakdown in that structural rigidity upon impact, right?
Total breakdown.
Because the researchers found two wild discrepancies during this early stance phase. First, the external oblique, the EO, which is a major core muscle responsible for trunk stability, showed 20% lower activity on the injured side.
If we connect this to the bigger picture, a 20% deficit in the core at the exact moment of impact leads directly to a biomechanical failure known as pelvic subduction, commonly referred to as pelvic drop.
Pelvic drop!
Yes, along with lateral trunk flexion.
Let's visualize that pelvic drop for a second. Think of your pelvis like a bucket full of water sitting right in the center of your body. Your core muscles, like the external oblique, are the hands holding that bucket perfectly level.
I like that.
If your core fails to hold it level when your foot violently hits the ground, the bucket tips forward and spills the water. And because we established earlier that your hamstring attaches to the bottom of that bucket, tipping it forward violently yanks the hamstring upward.
It is a brutal mechanical disadvantage. The weakened core allows the anterior pelvic tilt, which basically stretches the already overloaded hamstring even further during the most forceful part of the stride.
Which brings us to the second and perhaps most baffling piece of data from the early stance phase.
The gluteus medius data.
Yes. While the core was firing 20% weaker, the researchers found that the gluteus medius, the GMED, a muscle on the side of the hip, was firing 40% higher on both sides for the previously injured players.
40% higher.
Wait, hold on. You just said the core is 20% weaker, but the side of the hip is firing 40% harder. That feels completely contradictory. Isn't a harder firing muscle providing more stability to the system?
Normally, yes.
Yeah.
In a healthy system, a strong signal usually correlates with optimal force production and stability. But in the context of this kinetic breakdown, that massive spike in electrical activity is not a sign of strength or stability.
What is it then?
It is a desperate biological panic response.
A panic response?
Yes. The central nervous system realizes the core has failed. The pelvis is actively collapsing laterally. So, in a frantic attempt to stop the structural failure, the brain sends an emergency red alert signal to the gluteus medius, screaming at it to stabilize the shifting pelvis.
It's basically redlining the engine to try and keep the car from spinning off the road.
Exactly. That 40% spike is pure biological desperation. But the tragedy of this overcompensation is found in the timing data.
The timing data?
Yeah, the researchers discovered that the peak activation of the gluteus medius is delayed by 6% in the injured group compared to the healthy players.
A 6% delay sounds, microscopic. But in the context of a dead sprint, a 6% delay is like your car's airbag deploying a fraction of a second after your head has already hit the steering wheel.
That's exactly what it's like. The foot has already struck the ground reaction force has already traveled up the leg, and the pelvis has already started to collapse before that massive stabilizing signal even reaches the hip.
Oh man, so the muscle fires as hard as it can, but the structural damage to the kinetic chain is already done.
Exactly. We have to ask why that delay exists in the first place. When an athlete suffers a severe soft tissue injury like a hamstring tear, the area is flooded with nociceptors sending intense pain signals to the brain.
Sure, it hurts a lot.
Right. And even after the physical tissue heals, the central nervous system often undergoes a form of neuroplasticity. The motor cortex actually alters its activation patterns.
Wait, it permanently changes how it fires?
Often, yes. Perhaps as a subconscious guarding mechanism or due to lingering neural inhibition, the software gets corrupted. The brain is subtly rewiring the firing sequence to protect the area, but in doing so, it creates a timing deficit that virtually guarantees re-injury.
It paints such a clear picture of a biomechanical disaster. Let's just zoom out and summarize this perfect storm.
Please do.
As the leg swings forward, the primary glute fails to hit the brakes, forcing the hamstring to absorb all the forward momentum. Then, the moment the foot impacts the ground, a weakened core allows the pelvis to tilt forward like a spilling bucket, which violently yanks and stretches that already overloaded hamstring.
Right.
Meanwhile, the side of the hip is firing frantically to stop the wobble, but the signal arrives entirely too late. The hamstring isn't the problem at all. It's simply the last remaining thread holding a collapsing kinetic structure together until the tension becomes too much and it tears.
Brilliantly summarized. Identifying this precise sequence of failures brings us to a critical pivot point in sports medicine.
How so?
Well, if the timing and the surrounding kinetic chain are the actual disease, our entire clinical approach to treating the symptom has to evolve.
So what does this all mean? If the timing is the actual disease, how do we treat it? Because right now, the standard physical therapy protocol for a pulled hamstring heavily relies on isolation exercises.
Unfortunately, yes.
You go into a clinic, they put you on a padded table, and they have you do Nordic hamstring curls. You hook your heels under a bar and slowly lower your torso toward the ground, basically isolating the back of the leg. It is purely targeted hamstring strengthening.
Right. And the Nordic hamstring curl has been championed as the gold standard in rehab for years because it focuses on eccentric strength.
Building the muscle's capacity while it lengthens.
Exactly. It absolutely makes the muscle physically stronger. But the authors of this study present a really compelling clinical argument based on their findings.
Which is?
If the biceps femoris is receiving normal electrical signals during a sprint, and the true mechanism of injury lies in the delayed neurological timing of the core and the glutes, isolating the hamstring on a static table is woefully insufficient.
You are building a stronger tire, but you are completely ignoring the misaligned suspension that caused the blowout in the first place.
Exactly. The researchers emphasize that clinical rehabilitation must incorporate PATS programs.
PATS, what does that stand for?
Progressive agility and trunk stabilization. It is not enough to just increase the maximal force a localized muscle can produce. You have to actively retrain the corrupted central nervous system.
Let's paint a picture of what that actually looks like, because a KTS program is completely different from lying on your stomach doing leg curls, right?
Completely.
You aren't just doing heavy squats or holding a side plank until your abs shake. PTS involves dynamic reactive movements. It involves bounding, changing direction, and reacting to sudden perturbations.
Yes. The clinical application here is that you must train the external oblique, the gluteus maximus, and the gluteus medius to fire together in midair before the foot even lands.
So the neuromuscular coordination has to be flawless.
Flawless. The brain must relearn how to activate the core and the glutes proactively. It has to anticipate the violent ground reaction force of the early stance phase, rather than frantically reacting to it after the pelvis has already begun to collapse.
You are quite literally rewriting the software code for human locomotion.
That's exactly what you're doing.
And for you listening, whether you are a competitive athlete, maybe a weekend warrior hitting the local soccer pitch, or just someone trying to stay active without chronic pain, this is a massive, actionable takeaway.
It really is.
Holistic movement training, like training your body to move, brace, and react as a unified, coordinated system, is infinitely superior to simply doing isolated stretches on a sore muscle.
Couldn't agree more.
If your lower back aches after a run or your hamstring keeps feeling tight, doing 50 toe touches isn't going to fix a core timing issue that only manifests when your foot strikes the pavement.
No, it won't. It demands a highly intelligent, holistic approach to our own biology. We must respect the intricate complexity of the kinetic chain.
Absolutely.
The precision of tracking 10 different muscles at 240 frames per second completely removes the guesswork from rehabilitation and replaces it with actionable neuroscience.
It really does. But, the implications of this data extend so far beyond just a soccer pitch.
Oh, without a doubt. And this raises an important question about the broader landscape of chronic pain. Well, if hamstring injuries, which are incredibly prevalent across multiple sports, are actually just a downstream symptom of core and glute timing failures, How many other chronic recurring injuries are simply the victims of a silent failure in a completely different part of the kinetic chain?
Oh, wow. That's a great point.
Consider tennis elbow, or runner's knee, or chronic Achilles tendinopathy. What else is our central nervous system compensating for right now, completely under the radar, while we ice and massage the wrong joint?
That is a fascinating thought to carry with you the next time you feel a twinge of pain.
Definitely something to think about.
Well, if you want to truly understand these biomechanics and explore the data for yourself, I highly encourage you to read the full article by Ohtsubo, Saito, and Hirose in the Journal of Sports Science and Medicine.
It's a fantastic read.
It is a brilliant example of accessible scientific clarity, and it will permanently change how you view human movement. And hey, if you enjoyed unpacking this incredible research with us, please remember to follow the channel and turn on notifications so you never miss another deep dive into the science of human performance.
Thanks for listening.
Because the next time you go to replace a blown tire, you might just want to check your suspension first.